Hi, I'm Terrence Kommal, the Engagement Officer of the Healthcare Business Network, the network that was formerly known as the Healthcare Industry Network. To put things into context, I'd like to just give you a quick recap on how we find ourselves here on the rebranding and the renaming of the Healthcare Industry Network to the Healthcare Business Network. In 2012, Kodak, one of the world's original largest imaging companies, had filed for bankruptcy. That was because, in my understanding, Kodak had believed it was a film and camera company and not an imaging company. The reality is, Kodak was supposed to be an imaging company, but their executives focused more on their product than the ecosystem and the industry they operated in. Very similar to that, YPO is an organization initially built for leaders and to help and support each other and grow an ecosystem, a community, and a world in which members, their families, and the YNGs could flourish together so that they could make progress in their personal, business, and social lives. But YPO itself has also evolved into the new YPO 3.0 strategy as released by Pascal Jacquin as now the immediate past chairman of YPO. And the thinking behind that, in my understanding, is we've spent a lot of time, and I was privileged to spend time with Pascal and Scott at Davos this year, and the global thinking out of the World Economic Forum, global leaders, and everyone else internationally focuses on what are we doing for our environment? What are we doing for those that are not our shareholders but are our stakeholders? What are we doing for the entire world? The United Nations has encapsulated that in what it calls the United Nations SDG goals. And those focus areas focus on distinct key areas on which businesses, communities, and governments should focus their energies so that they can become more relevant and more impactful within the global community. In that thinking, and in my understanding, YPO 3.0 talks to exactly that strategy, focusing on what can we as an organization, what can you and I do as members for those within our current environments, outside of our current environments, and how can we essentially add impact and improve the lives of those around us in our home countries and internationally. Therefore, based on such a magnanimous change of YPO and its new 3.0 strategy, the board of the Healthcare Industry Network convened in May and June this year in New York City, in New York. Around that thinking, there was an agreement that healthcare is not just about the industry and not about the perspectives of only those who provide healthcare. And in my understanding, and the impression created by the industry network as it was formerly known, is it spoke of or created the image of those who merely provide, so hospitals, drug companies, healthcare providers, and related parties. But like in the thinking and the analogy of Kodak, healthcare is not about just providing product. It's about the entire ecosystem, the business of healthcare. And that, in my understanding, is why we as an executive, the Exco and the board, have collectively decided to rebrand this network so that it speaks to the business of healthcare. The reality is, the business of healthcare doesn't only speak to the hospitals or the doctors, because it's commonly understood or perceived sometimes that healthcare is about doctors and hospitals and other providers in that ecosystem. The reality is, healthcare is actually about health. People don't consume healthcare or participate in healthcare services, facilities, and processes because they want to. They participate because they want to remain healthy so that they can continue with their lives, in their businesses, in their families, in their individual capacities, so that they can progress and enjoy what life's about. Therefore, in my understanding, healthcare business includes everyone. It includes those who fund healthcare, those who participate, and it includes you as consumers, whether you actively participate as a member of the business healthcare environment or as a consumer have an interest in what influences that. How is healthcare financed? We speak about international healthcare programs, we speak about national healthcare systems. In Southern Africa, my home country, we speak about national health insurance. But all of these factors affect everyone because as consumers, as providers, as facilities, as funders, as governments, and as a society as a whole, healthcare impacts all of us. But Healthcare as a business involves all of the social determinants that are beyond the actual direct environment of a consultation or an admission or a dispensing of medication. In my view, it includes, as the United Nations has the view, it involves all the social determinants of poverty, the inefficiencies of healthcare provision, of transport, of lack of access, and the lack of universal healthcare access to people internationally. And these are the factors that determine the business of healthcare. So we invite you to participate in your new branded healthcare business network in YPO, which is more encompassing, more involved, and more aligned with the United Nations SDG goals, and in the YPO environment, very much YPO 3.0. All the best.